This is my audience. My name is Jasmine Jefferson. My presentation is on Alice in Wonderland syndrome. I will inform my audience about the Alice in Wonderland syndrome and how it came about. Alice in Wonderland syndrome is a perpetual disorder characterized by distorted of vision, perception, the body schema, and the experience of time. If I had a world of my own, everything would be nonsense. Nothing would be what it is because everything would be what it isn't. And contrary-wise, what is, it wouldn't be. And what it wouldn't be, it would be. Many aspects of Lewis Carroll's life influence his writing. Some of these aspects include his mathematical background and logical disposition, interest in photography of little girls, abnormal eating habits, dual personality, sleeping difficulties, Victorian lifestyle, and neglected childhood. These characteristics of his life are reflected in his literature, including in his most well-known novel, Alice's Adventures in Wonderland. Alice in Wonderland syndrome symptoms have both diagnostic and therapeutic consequences that differ substantially from those in schizophrenia spectrum disorders and other hallucinatory syndromes. According to medicalbag.com, Todd syndrome, most frequently referred to as Alice in Wonderland syndrome, is a disorientating neurological condition that primarily targets children. Alice in Wonderland syndrome affects human visual perceptions of the shapes of inanimate and animate objects that appear to be smaller or larger than normal. Dr. John Todd, a British psychiatrist, first described Alice in Wonderland syndrome in 1955. Todd gave its name by the famous novel by Lewis Carroll's Alice's Adventures in Wonderland, as the illness resembles the events experienced by Alice. Considering in one recent analysis of 81 people who experienced this syndrome, 17 reported the duration of the episode. 9 of these participants had episodes lasting less than 5 minutes. 7 experienced episodes lasting more than 5 minutes. However, one person in this group had an episode last 2 days. Alice in the Wonderland syndrome can affect individuals of all ages, and as many as 1/3 of sufferers continue to experience ongoing episodes. Episodes of Alice in the Wonderland syndrome aren't hallucinations, although the experience is quite vivid. The individual recognizes that what they are seeing or feeling is not real. Episodes can occur during a headache or migraine, and some consider the visual disturbance to an aurora that comes before a migraine. Those who experience Alice in the Wonderland syndrome often have family members who suffer from migraines, may also develop migraines later in life. Triggers from an episode of Alice in the Wonderland include, but aren't limited to, migraine, stress, brain tumors, Epstein-Barr virus infection, drugs, particularly cough medicine, epilepsy, and infections. According to Dr. Sheena Aroa, a Stanford neurologist and migraine specialist, was the first to perform an MRI scan on a 12-year-old patient in the middle of an episode. Her report concludes that electrical activity caused abnormal blood flow in the parts of the brain that control vision and process texture, shape, and size. To conclude, now that you've got the basis on this rare condition, keep in mind that this rare neurological diagnosis can be confused with drug intoxication or psychosis. There is no proven treatment for Alice in Wonderland syndrome. However, rest and dietary changes are indicated. Most causes of Alice in Wonderland syndrome are self-terminating and resolved by adulthood. One of the deep secrets of life is that all that is really worth doing is what we do for others. Alice in Wonderland is a syndrome of disordered space, time, and body image. It was first described in 1955 by John Todd. Lewis Carroll suffered from low leptin hallucination. Alice in Wonderland is a rare condition which you have temporary episodes of distorted perception of body size. Episodes happen most often in children and young adults. Some consider it to be visual disturbance to the aurora that comes before a migraine. It's a rare condition which is temporary. People feel that their body is larger or smaller than normal, most often in children and adults. Their bodies have been altered in size and have visual hallucinations, impaired sense of passage, and it can affect your visual perceptions.